So one of the biggest, if not the biggest, healthcare company, Kaiser, is seeing something like 75,000 nurses going on strike because the nurses figured, well, since the hospital was making record profits, well, then they should be sharers in those profits with the rest of us. Now, of course, these people have the mindset of an investor, but the risk of an employee. And so that's why employees don't get to vote, for example, in publicly traded companies. This is why employees should never get a vote, because at the end of the day, they're just going to vote themselves more money because you made more money. So they want to increase the business's labor costs into the future for what may or may not be similar profits. We don't know why Kaiser had such a great year, and it doesn't mean that just because they had a great year that they're going to have that same year next year. We don't know that. You, as a business owner, you can't guarantee that you're going to make record profits the following year. And of course, we have inflation. But in socialism, the people can hold the taxpayers, right? Because this is the hospital is basically going to get their money from Medicare and Medicaid. It's basically going to come from the public. And so as much as people want to sit there and champion that the nurses deserve it, they do such a fine thing, a fine job, etc. As a nurse, I would say that's not the case. If you want to earn more, then you have to work harder. I mean, nurses only work 13 days out of an entire month. And many of these nurses make six figures. Especially if you're on night shift, you've got differential, you've got years of, many places have how many years you have. You might get extra money based off of years. If you do your ACLS, or if you do your critical care, or if you do whatever, if you get some sort of certificate, you'll make a little bit of extra money. And so instead of saying to the employer, hey, we will guarantee if you make X amount more profit, then we want to share it. We want to be sharers of that. And so that would be an agreement that would be agreeable to a business owner. Say, hey, I'm going to come in, we're going to make more money. We're going to help you make more money. And as a result of helping you make more money, we want to be a sharer in that. It's just like me. I do investing. And so as an investor, I have an incentive for the company, obviously, to do better. Now, if the company loses money, well, then as an investor, I don't make anything. But as an employee, I still get my guaranteed, agreed upon salary, right? Just like as a travel nurse, I agree, I can't show up to a hospital and then just be like, after I've already said yes to whatever agreement that they've offered me, I can't turn around and say, well, you know what? I think I deserve more money. And it's like, well, let your yes mean yes. And for a lot of these people, the reality is it's the taxpayer that's basically being held hostage. The same way you see the MTA hold New York hostage. It's the only option for people to utilize the transit system. And so when they want more money, they just say, hey, we're going to vote for it. And they hold the New York taxpayers hostage. And every year, every time they go on strike, they get whatever extra money that they want. And what happens to the fare? I think the fare now is like almost $3 for one ride. Are you getting better service? Is it more reliable? Are the subways cleaner? Are they on time? No. You're not getting better service. You're not getting better anything. If anything, you're getting worse service. But you're paying more for it. And it's the same thing with healthcare. The third leading cause of death for the person coming into the hospital is medical error. Is that going to drop down to fourth or fifth? More than likely not. But you, as a taxpayer, you're going to pay more. For a lot of people, that were cheering, for example, when like the UPS workers went on strike. And then, of course, if you watched in the comment section, I saw in like Instagram, a lot of people were like, yes, now do the nurses, now do respiratory therapists, now do the teachers, now do the bus drivers, now do whoever else. What is that going to do? It's going to cause inflation. Who's going to pay for it? You. You're going to pay for it. So before you go and champion all these people out there that are going on strike saying, I want more money, you're going to ask yourself, are you going to get better service? Is the service going to be more reliable? I mean, shit. Hospital I'm at now in upstate New York, there are flies everywhere. And I'm like, why aren't there someone here at night to take the trays away? You've got trays that are just sitting here for 8, 10, 12 hours. And you just got fruit flies everywhere. You walk into the room, they're fruit flies. One day, I went into my patient's room, and the patient had flies on them. And I'm like, you want more money for this kind of service? I saw the same thing when I was in Arizona. There were mice there, and the staff are just like, well, this is whatever hospital, right? Whatever you name the hospital. They're like, oh, welcome to whatever it was. And the reality is you're paying more, but you're not getting the quality. You're paying more for what should be quality, but you're not getting it. And so as a taxpayer, you have to say enough is enough. You have to be willing to say enough is enough. I mean, we only work 13 days out of a 28, 30-day calendar month. How much more do you want? If you want more money, work an extra shift. If you want more money, go back to school. Offer more services. Offer more to the public. Offer more to the employer. Go out and compete in the marketplace for market share. If you don't like that these big hospitals have such big market share and you're not sharing in, you're not reaping in the spoils, well then go out there and start a business. Go out there and offer your services individually. But the reality is a lot of these people don't want to do that. They just want more and we're going to vote for it. And this is what you get in socialism. This is what you get in socialism. People feel that they're entitled to other people's money. And if you don't give it to us, well, we're going to hold you hostage. They're going to hold the patients hostage. We're going to hold the city hostage. You're not going to be able to get on the train. We're going to hold the city hostage, and your safety is going to be at risk when the police go on strike. We're going to hold the city hostage when the firefighters want to go on strike. When the teachers want to go on strike, we're going to hold your kids hostage. This is what you get in socialism. This is not a free market. In the free market, you have to go out there and offer a better service. You have to go out there and offer the service and offer it better than the people that you're competing against. And then you'll be able to get a bigger share. You'll offer a better service. You'll do something more reliable. You'll do it for cheaper, etc. Well, we don't have a free market. We have socialism. And this is what you get in socialism. And prices are going to go high. I mean, I've talked about this before where I went, and the whole purpose of creating the nurse practitioner role was because there were so few doctors and people were complaining about the prices. And nowadays it costs just as much. And then ironically, because the nurse practitioners were doing very similar roles as the doctors, then they wanted more money. And so what did that do? It caused prices to go right back. So you're basically paying for the same amount of money to see a doctor to see a nurse practitioner. And it is what it is. What are you going to do about it? The reality is that people have to be willing to work harder. They have to be willing to work and supply what they need instead of constantly trying to vote for somebody else's money. But it is what it is, and this is where it's going to go. You have to pay attention. For a lot of people cheering for these nurses that are going on strike, talking about, oh, they deserve it. Let me know when you get that bill. Let me know when you go see your doctor. Let me know when your copay goes up. Let me know when the government has to raise taxes. Let me know when the inflation starts to go higher, because now you have 75,000 workers in that area that are going to be earning more money. Let me know when you try to ship something via UPS if those workers deserved it. Let me know when you get on the train and you're paying $3.25 instead of $3 if you think the MTA does it. Let me know when you see rats on the subway if you think that these people deserve the money that they keep asking for. It is what it is anyway. I'm going to leave it here. I got work tonight. Have a good night. Take care. Thanks for watching.